everyone, in this video I will be sharing how you can use uworld demo to see the next generation questions, and also I will explain some of the features of an uworld so you can see if you want to use it as an account to practice the NCLEX questions. And it's 1st of April, as you know from today the NCLEX has changed to the next generation, so these questions will be of great use. And let's get started. So you can click on uworld demo and then you will see this first option, uworld. You can click on this and we can click on the option view demo, and when the screen pops up you can continue. So here I will explain what the tutor mode means. The tutor mode is by default selected. In this, when you answer a question, when you submit, you will see whether you did which options you did right and wrong, and then if we click here timed, so it will be time, like you will be able to see a clock and how much time you're doing it. By default, the traditional means the old generation questions are selected. So here are few new next generation. We will also select this option, and in this I will select all the subjects. As you can see, these are the major basic categories of the NCLEX questions. Like adult health is categorized under 1, and then you can see the different options here. I will be selecting 1, but when you are using uworld for your personal use while doing questions, you can select one option from here, from subject, and then also from the system you can select one option if you want. And but today I will be selecting all. For example, if you want to do just the fundamental questions, so you can just select the fundamentals, and then which chapter fundamentals you want to do, you can select from the systems, like cardiovascular fundamentals you want to focus on. So in this, these can give you only questions that are of that particular choice. So when we go scroll down, we see a box that say maximum allotted questions are 75. So 75 questions are given to you in a test if you have your own account on uworld. But if you are using the demo, in demo we will only be able to get 31 questions in a test. So this screen pops up, it says 31 questions only in tutor mode. However, paid subscribers can specify any number of questions, maximum of 75. So we click OK and we get this question. So we get the test status of 31 questions. In this, the first one that came up, we can also I will be doing this question with you for you guys, just the first part, so you can get an idea of how we can what type of new questions you will get in the next generation NCLEX. So this is the case study. In a case study, the screen will be divided into 2 parts. So this will be a split screen. The one is the main scenario that is given to you, this one, and then this one will be the question that is related to the scenario that is given in the question. As you can see, item 1 of 6. So it also says the following scenario applies to next 6 items. It means the next 6 questions will be based upon this same scenario. So it becomes a case study. So as we can see here, it says click to highlight the 6 findings below that are priority to follow up. So after reading the scenario, we have to consider which findings we have to report to the physician, which are necessary, which are priority. As you can see, when I am scrolling through the lines, some of the lines become yellow. So these are the options that are given by the uworld, that from these lines, these yellowing highlights, we have to mark which we think are the correct answers. So let's begin reading the scenario. It says nurses notes, emergency department 0845 845. The parent brought the client to the hospital after finding the client in the bathroom, vomiting and unable to stand without assistance. The client states that she has experienced sore throat and nasal congestion for the past week. Okay, so this shows that it's being highlighted. So if we want to select it, we will click it, but I do not want to select it. So because I do not think this is a priority, so we can read next line. She reports 4 episodes of emesis during the past 24 hours and abdominal pain that is diffuse, constant, radiating and rated 3 on the scale of 0 to 10. The patient also reports polydipsia and polyuria over the past 2 months. The last menstrual period ended approximately 6 weeks ago with no abnormalities. The pregnancy status is unknown. Okay, so this becomes a priority as we have to know the pregnancy. Okay, so the pregnancy status is unknown. The client is taking no medications she reports no smoking, alcohol or recreational drug use. Family history includes hypertension and diabetes mellitus. The client appears drowsy and is oriented to time and person only. Okay, so this is a finding that needs some follow-up. The abdomen is soft without guarding. Rigidity and rebound tenderness and bowel sounds are normal. So as you can see, this is an option given by the questions that you can select this. But for me, this looks normal, so I will not be selecting this option. No blood is present in emesis. Respirations are rapid and deep. Breath sounds are clear. Vital signs are temperature is 98.8 and pulse is 128. Okay, I will be selecting this. Respiration 30, that's high. And BP is 88 over 60 mm of mercury. So this is finding that is a priority. And finger stick blood glucose level is 600 mg per dl. Okay, so this is also a finding that needs follow up. So we have selected 6, 1, 2, 3, 4, 5 and 6 options. They have in the question they have asked us to highlight 6 findings that are a priority to follow up. Okay, so when we submit here, we can see the answers that are correct and that are wrong. Like if some of the answer will be wrong, so it will be crossed out. And also there is explanation given by the uworld. This is the best part by uworld. The rationals that are given, you can read through them and then you can see which answer you did right and wrong. So when we click on the next option, so now the second item comes. So the scenario on this side remains same. It's the same scenario, but the item means the next question, it gets different. So in this way you can view the questions of the next generation on uworld demo. And if you find this video helpful, please share it with your friends who are going to write the NCLEX next generation. And also please comment if you want me to make such videos, if this is somewhat helpful for you guys. And you can comment any other if you want any other information about NCLEX or any particular topic you want me to make video with. That will really help me grow this channel. Thank you very much.